My name is Edward Shin, and I am the CEO, co-founder of Quality Reviews. And for those of you who don't know what we do, we help health systems, hospitals, any healthcare provider organization improve experience through real-time feedback that will facilitate service recovery. And it is my pleasure today to introduce and welcome Dr. Wendy Dean. Dr. Dean is the CEO and co-founder of the Moral Injury of Healthcare, a 501c3 nonprofit, and a physician by training. She actually trained in surgery, emergency medicine, and psychiatry, so triple threat. So welcome, Wendy. It's good to have you.
Thanks so much. It's a pleasure to be here.
So the topic today, we're going to talk about physician burnout, broadly speaking, but as indicated in the description, as well as what you do, let's just dive into it. Burnout versus moral injury. What's the difference? Talk to us a little bit about that.
Yeah, so moral injury came up for my co-founder and I, Simon Talbot, because we had been talking to our friends about what their struggles were. They were clearly distressed, but none of them felt like burnout was an accurate description. What they said was, I know how to manage difficult things in long hours. What I don't know how to manage is knowing what my patients need and being unable to get it for them because of constraints that are outside of my control. So when you boil it all down, burnout says that the individual is unable to tolerate the demands of the system. Moral injury says the system is broken, not the individual.
Got it. So it's a complete shift in framing it, right? And one burnout is kind of putting the onus on the individual, saying, just suck it up, get better, do some yoga, get over it, versus moral injury, which is like, hang on here, the system, we need to take another look at the system. So I think that's a great way to reframe it. You wrote a pivotal article in Stat News back in 2018, and I read that article. A lot of great things come from that article. But talk to us a little bit about that frame shift. So, from physician burnout to the health system. So previously, leadership will say, well, sounds like you need some extra days off, or maybe a shift change, go from nights to days, or, you need some night float coverage. What led you to write this article in the first place? Because it's been downloaded hundreds of thousands of times, if not more.
Yeah. So really what led us to the article, so this is a kind of a long story, but I was working for the Department of Defense doing research funding oversight. In that job, I got to see clinicians across all different kinds of health systems across the country. They were all struggling with the same thing, which was, I love my job. I love my job. Not my job. I love what I do. I love the medicine that I practice. I love my patients. What I can't stand is everything around it. And so I started thinking about, in the military, so there was also this question of physician suicide. And I was working down the hall from the office that was looking at suicide in the military, which had become an alarming crisis. And so I thought, okay, well, what do we know about physician suicide and burnout? And what are we doing about it? And when I did the deep dive, the answer was, we don't know much about it, and we're not doing much about it. So I started thinking, are we looking at the right thing? Because if we're treating burnout, if we've been assessing and treating burnout for 20 years and we're not making a bit of a difference, do we have the right diagnosis? Right? Because as a good clinician, when you make a diagnosis and your patient comes back after 2 different treatments and says both of those treatments have not worked, the humble physician will say, okay, maybe it's not the treatments that are failing this patient. Maybe I have the wrong diagnosis. And so Simon Talbot and I we went back to we sort of stripped this thing down to the studs and said, what's really going on? what is the essence of what people are struggling with? And it wasn't about their busy schedules. It was about the fact that they knew what their patients needed and they couldn't get it.
Got it. You mentioned physician suicide and the military, and in the Stat News articles, you said that as the military suicide rate has increased and it's become a crisis within the military, you quote statistics that says that physician suicide rates are double that of military suicide rates. So as crisis point as it is in the military, it's even much higher in the physician community, and you hear nothing about it, like absolutely nothing about it. Let's just dive right into that kind of mental health, suicidality, and the consequences of moral injury, right? Because people